Today we're going to talk about Phacodynamics, and for us the secret of Phacodynamics are in the evolution. So I'm going to have an infinity, I'm going to have a centurion without active sentry, I'm going to have a centurion with active sentry, and we could always talk about constellation making an amazing machine to do Phaco, but we're going to concentrate in these three and the evolution from machine to machine with the great Ale that is going to be here for us with Alcon, and we're going to talk about a lot of details about the machines. So the first thing is, it looks kind of old, but I did my fellowship with it, so it's not that old, or at least I like to think that. But something very important happened. This machine was very efficient, very controlled, but had a huge impact in ultrasound, more specifically with the OSIL ultrasound. It was the first time we launched OSIL ultrasound. So to talk about the machines, we're going to talk about two things. We're going to talk about the ultrasound and the Phacodynamics and the Fluidics. Okay, so we're going to divide those in two, and we're going to see the evolution in each of them. So the first thing is we're going to show you in a video how torsional ultrasound does the movement. So I don't know if you have any more concepts about that.
Yeah, basically when we moved from longitudinal to OSIL, it was a change in the way the tip was moving. So before we were moving in a forward and backwards movement, and now with OSIL we have this side-to-side effect that reduces the repulsion and reduces the amount of energy that we deliver to the cornea as well. So basically that was like the big innovation that we had in 2006 with Infinity. And after, we will cover a little bit more on the evolution, as Dr. Ivo said.
Excellent. So remember, guys, to do something very simple, longitudinal ultrasound was like this. Torsional changed it completely. It was more efficient. The tip changed it to a Kalman tip, yeah, to be able to do ultrasound, torsional ultrasound. So we had a more efficient delivery. Very important in this case, in Infinity, we were used to, for example, for sculpting or even quadrant removal, to use big numbers, right? It would be 90, 100 of ultrasound, and that will change to centurion. That's important to know. And the second thing that is very important, that is going to be a big leap, is irrigation and the fluidics themselves. As you can see, we used to have a gravity-based irrigation, so the bottle will go up or down to control what was going inside the eye, and then with a peristaltic pump we will extract, right, with an aspiration rate that will be how fast that bomb is moving to create flow, but also we can create vacuum. And it's very important to understand this. Let's go to the next big leap, especially in fluidics, correct? So as you can see with this machine, that is the Centurion with active fluidics. We don't have a bottle anymore. And why is this? Because that bag is going to be inside the machine and it's going to be compressed to deliver a controlled intraocular pressure in the anterior chamber at all times. So this was a huge leap, and I want you to understand what happened with the IOPs. For example, if you have a 95 bottle, it will be a very high IOP, that it became lower and lower and lower. And for example, think about it, 50 of IOP is a 70 centimeters bottle height, and for B even that it's kind of high. So for example, without active sentry, I'm using 44, 42 of IOP. That is a very low bottle. So what active fluidics gave us, it's a control. So the focus became the anterior chamber. We are doing everything we can to have a stable IOP in the anterior chamber. Think about that. That's very important in the point of view of fluidics. And it allowed us to have a lot of stability, but with lower IOPs. Ale?
Yeah, I
agree with you. Basically, the innovation is coming from moving from a gravity-fed system to a system that has two plates that are going to be compressing a VSS band, right? So in real time, we are going to know what you have in the anterior chamber, and we are going to compensate for those changes. So basically, instead of having a bottle going up and down, or an anterior chamber that is moving and a bottle that is stable, right? Because you need to react to what's going on. Now it's the opposite. You will have a very stable anterior chamber, and the back is going to be being squeezed inside the system.
Excellent. Another important thing is, remember, now we're talking about fluidics. We need to talk a little bit about ultrasound. The way of deliver ultrasound is the same, but we had something new that it was amazing. It was the balance tip. We're going to show you how the balance tip is in its architecture, but the important thing here is that the delivery is more efficient. It has a balanced design, so the ultrasound, you don't have this wave of ultrasound that spreads away.
Yes.
So what we did, and you need to know, is ultrasound started for example, for 100, the 60 became that 100. So if you're used to a machine like Infinity and you're changing to Centurion, it's very important for you to start lowering the ultrasound, because this ultrasound with this phaco tip is more efficient. And that always gives us a second important concept in Phacodynamics, and that is not only the parameters that are right here is what matters. It matters the sleeve, the phaco tip, how well your incision is done, if the eye is myope, hyperope. There's many other factors that's going to be important in Phacodynamics. Again, ultrasound is what's going to destroy, or actually what's going to de-occlude the tip. Okay, that's the important thing. And fluidics is going to make a stable anterior chamber at all times, and also will remember that ultrasound will generate heat and energy, so fluidics can make that more stable.
Right. So yeah, I agree with you. Basically, the design of the balance tip is to decrease the movement at the incision site and to increase it at the distal end. So you will have the movement where it's needed and it's enhanced. So as Dr. Ivo said, if you're using an Infinity at a 100% all-seal amplitude, you should decrease it to a 60% so that you don't feel it like too aggressive.
Excellent. So the next big step of the evolution was the Centurion system with active sentry. And as you can see, and we said before, the handpiece is going to change. You're going to have new software and hardware inside the machine. And what you're going to have is a sensor in the handpiece. So that sensor is going to be like it is in the anterior chamber. So the response velocity is going to be much higher. And now you have more control again of what it's important, that is the anterior chamber. Here you can see that, look at that, the IO piece keeps dropping. We are actually doing right now phaco with IO piece of 20. Think about that bottle height. It's so low. And think about an eye that had a procedure with an IOP of 20 versus an IOP of 95. I think if I put 95 here, it's gonna be a bottle of
80.
Yeah. I'm sorry. That 95 is gonna be an IOP of 80. So big. Okay. From 80 to 20, there is a big difference. So that is what happened with this machine that we're gonna do a phaco. So you understand a little bit more about Phacodynamics. One of the important things about Phacodynamics, the most important concept and principle is you need to balance what goes in, what goes out, and always be careful with the ultrasound, because that's energy that produces inflammation. If you understand that, you're good to go. To do that, we're gonna divide what's happening in sculpting and quadrant removal and cortex removal. It's very important for you to understand that to start, you need parameters with safety, and also you need to be able to sculpt. It doesn't matter if you go to chop, even early, you always need to know how to sculpt, because that could be very helpful in many situations. Okay, so to sculpt, we like to say that ultrasound is king. Very important that ultrasound is the one who's gonna sculpt that trench so you can then crack it. Okay, so the important thing is gonna be ultrasound. You want remember 60 of ultrasound in this machine. It's very powerful. Maybe you can raise it in a very hard cataract, but this is gonna be your starting point. Another important thing is if you start with 10, not 0, and that's because the ultrasound is more efficient if you approach the lens already with ultrasound on. Very important. And continuous. Okay, in this case what you want is ultrasound to be delivered. You don't want to save ultrasound. Again, one very important concept is, since you want the machine to work correctly, you're going to put a vacuum of 135 and aspiration flow of 30. That it's higher than it comes from the machine.
That's coming from infinity, right? So the tubing of the system is a little bit different. So to have that, to have the pump working properly and efficiently, we move the vacuum to 135. So it's a little bit of increase, but it's going to be good enough for you as a starting point.
Excellent. So let's go now to quadrant removal. In quadrant removal, the concept to you is that fluidics are king. An ultrasound should be only used to deocclude that tip. Okay, so in this case, and because we're going to IOPs of 20, maybe you can start with IOPs of 30 to be more comfortable, more safe, but the machine will allow you to go that deep. And the important thing here is to have a correct aspiration flow, that it's fixed, so the machine is moving and attracting things to the phaco tip, and also a vacuum that when you're occluded, it's sufficient to remove less material. About ultrasound, there is some debate here if you use it continuous or burst. The important thing here is for you to understand that ultrasound should be only to deocclude the tip. So you want it as more efficient as possible. I used to use it in a burst mode, so you have enough time and you can track and save ultrasound, but it's completely valid, and there's many surgeons that they use the torsional ultrasound for quadrant removal in continuous.
Right. Yeah, because the continuous also is not in need of having the fluidics helping you to bring the fragment back, right? So that's why we kind of recommend sometimes to use the Ozil continuous, so that you don't have repulsion and you have the flowability that you need with the Ozil continuous mode. But it's up to you.
Excellent. So there's many other features, but we're gonna keep it simple. Again, we had something very amazing with Infinity and the torsional ultrasound that was very efficient and very useful for us to deliver ultrasound. Then we changed it fluidics completely, and we have now active fluidics. We don't have the high bottle anymore. We're more about having a controlled IOP in the anterior chamber with the balance tip. And then here what we did was, since we have better sensors inside the anterior chamber, we can respond more quickly, and we can get those IOPs lower and lower to have better outcomes for our patients.
Totally agree.
Okay guys, so now let's do some phaco, what everybody loves, right? So we're gonna use a Bionic model, and we're gonna use active sentry to do this surgery. So first, what I'm gonna do is I'm gonna do a capsular rhexis, and then we are gonna talk about sculpting and quadrant removal. Okay, I'm gonna first do as I said, capsular rhexis. There you are. Here I have the flap. Right here, you always need to remember that this is simulated surgery. It could be something different. from the human eye, but the important thing here is to learn, is to understand the model. And in this case, this is going to be a wide cataract. Okay, let's put some more viscoelastics. And it's going to be a wide cataract that is going to behave as a very, very, very hard cataract. There you go. Visualization is very important at all times, but in this case, we really want to focus ourselves in the Phacodynamics to do sculpting and to do the quadrant removal. Okay, let's try to do it very nice, very round. This is a rhexis that behaves very, very hard. As you can see, the capsular rhexis looks very, very nice. Perfect. We're going to remove this, and we're going to do a little bit of higher dissection, very, very small. And then we're going to do a sculpting quadrant removal. Okay, so I get into down a little bit. I will do there. Can you see it? Perfect. So the nucleus is completely free and in the bag, moving freely. Perfect. So let's start. Again, as you can see, we said it before, ultrasound is going to be the king, and in this case, because it's simulated, we know it's very hard, and we're going to rise our normal parameters. Remember that there is a perfect technique to do it. You need to advance in position 3. Okay, advance in position 3 and come back in position 1. You can also come in position 2. But it's very important for you to understand the anatomy of that trench. It needs to have the correct width and the correct depth. Look at that. So we are seeing a little bit of the red reflex coming, so we can infer that we have a correct depth. Can you see it? Amazing. So this model is going to be good for you to talk about, you know, that trench. And now with the second instrument, we're going to do the cracking maneuver. As we said in this step, the important thing is ultrasound. Okay, and here the key is to go deep with both instruments and separate those fragments. Look at that. Look at that crack. It looks great, and you can train this very, very much. So we have already 2 halves. If you want to do it and it's too big, you can always rotate it and do another small trench, or you can, you know, bring it to the anterior chamber and start doing some chop. Again, if you want to do it, we can try always to do a small, when you're beginning especially, I recommend you to do another small sculpting, so you have 2 fragments, and then you go deep and you crack it. Look at that beauty. It's amazing. Now I have a very small quadrant. I go to quadrant removal, remember here, and here that this is going to be very important. How Phacodynamics is not only about the parameters you have, but how you deliver the ultrasound. So I'm in the safety zone in the center of the eye, okay, and I'm doing position 2 and position 3 to allow vacuum and the aspiration flow to do all the job. What's happening here is we had normal eyes, normal parameters for an eye, but this cataract behaves very, very hard. So look how it, you know, it's very difficult for me, and what I'm gonna do is I'm gonna do more aggressive parameters, because again, this behaves like a very, very hard cataract. So what I'm doing is I'm raising my parameters, as you can see in the screen, and look now how it's going to be much easier. There you go, and look at now, let's center the eye. Let's a little bit zoom out so you can see perfectly. Look at that. So again, the important thing is you only deliver ultrasound when the point is occluded. Okay, so I have it occluded. Look at that. Okay, and you can also hear the longitudinal ultrasound because this is a very, very, very hard cataract, and we did it perfectly. Now we have the small fragments. Again, I go in position 2. I occluded. Look, listen to the vacuum rising. When I have it, I bring it to the center, to the safety zone, and then I start doing ultrasound. Look at that. Ultrasound is very, very efficient. In a moment you have an occluded tip, and this is going to behave like a very hard cataract. So the important thing here is very, very good to train you in this. When you have a big fragment, you can also do chopping like this, and then you have smaller fragments, so they're more efficient to emulsify. Okay, perfect. So now we have the last half of the lens, and then I would love for you to understand the chopping technique. The chopping technique is to go to the fragment, position 2, you know, you see the vacuum rise, position 3 a little bit, then you bring it, and then you put the second instrument behind, and look at that. Then you have the chopping maneuver. One of the things you can get very superficial, like I did in the beginning. In the second attempt, I did it more perfectly, and then I did the chopping. The same thing, I have it. I need to control that fragment, and then I put my second instrument, and I do the chopping again, okay? Then I have smaller fragments. Look how efficient the ultrasound is. Remember, in this moment, the important thing is to have high vacuum. An ultrasound only will be delivered when the tip is occluded. When I have bigger fragments, the important thing is to chop. Always when you have it with you, okay? So now I'm doing a lot of chopping to just generate smaller pieces. Perfect. Always see your phaco tip. There's lateral movements that can help you a lot. Look at that. To be efficient, and that's perfect. So what we did is we did phaco in a very, very hard cataract. So again, thank you very much. But remember that phacodynamics are more than parameters. The key is and the secret is in the evolution, but not only about the machines, but in the evolution of you as a surgeon.